Welcome to Physician Focus. I'm Dr. Bruce Carlin. Deaths and injuries from firearms continue to shine a spotlight on gun violence as a public health issue, prompted by such tragedies as those in Columbine, Colorado, and Newtown, Connecticut. A growing number of physicians believe gun safety should be a routine part of preventive care. Among the most vocal groups have been the American College of Physicians and the American Academy of Pediatrics, both of which have put forth strong recommendations on ways to reduce gun violence. Yet the issue is a flashpoint for controversy. Laws banning physician discussion about guns with their patients have been passed, and the nomination of the U.S. Surgeon General was delayed for months over his position on gun control. This edition of Physician Focus will examine guns as a public health issue. Should gun violence be considered a public health issue like infectious disease or traffic safety? If so, what can be done to reduce the violence? And what role should healthcare, and specifically physicians, play in advocating for gun safety? With me for this discussion are Dr. Michael Hirsch and Dr. Robert Sagi. Dr. Hirsch is a surgeon-in-chief at UMass Memorial Children's Medical Center, professor of surgery and pediatrics at UMass Medical School, and medical director of the Worcester Public Health Department. In 2002, he established the city's Goods for Guns program, a gun buyback program that has taken more than 2,000 guns off the streets of the city. Dr. Sagi is vice president of the Medical Foundation Division of Health Resources in Action, a public health advocacy group. He is also a visiting scientist at Harvard School of Public Health, a member of the American Academy of Pediatric Committee on Child Abuse and Neglect, and a nationally recognized expert on childhood violence. Welcome.
Thank you. Well,
Thank you very much.
Good
Yes.
Mike, let me start with you. Why is this a public health issue? You're the head of the Department of Public Health in Worcester. Why is this public health?
Well, Bruce, I think we can state it a couple different ways. Since April 4th, 1968, the unfortunate assassination date of Martin Luther King, more people in the United States have been killed through domestic firearm violence than all the people that have died in wars fought by the United States since the inception of the United States in 1776. So it is a huge problem, and it is an epidemic in every other way that you would classify an epidemic of infectious disease or some of these other issues that you mentioned. The other factor in this is that we have as our example C. Everett Koop, our dear departed Surgeon General who just passed away this past year, who made a famous statement in 1985 that injury basically was the great undealt with public health issue. And I think that we've done so well in many other aspects of injury. We've dealt a lot with motor vehicle crashes. We've dealt a lot with falls. We're dealing with sports injuries and concussions. But firearm has been kind of like the great third rail of injury. We haven't really appropriately dealt with it.
So let's be clear. We're not talking about taking away your right to own a gun. We're talking here about keeping it safe when it's in your home and keeping your handling of it safe. Bob, you have any insight as to why that's public health?
It's public health because what public health tries to do is to preserve the health and lives of the public. And there's some things that I can do as a doctor and other things that need to be done on a larger scale. So one thing we know, for example, is that children are safer in a home without guns. And if there is a gun at the home, children are safer if the gun is kept locked and unloaded with the ammunition locked separately. That's basic information that every family with a child needs to know. And that comes from public health studies. It's something that we need to get the message out better so we can do better at stopping this epidemic.
I think, Bruce, David Hemingway, one of our friends and colleagues at the Harvard School of Public Health, has said it best. He basically said, we've learned to live with automobiles, right? We initially, when the automobile became all popular in the 30s and 40s and 50s, a lot of the crashes that happened were blamed on the driver. And I think that a lot of effort was put in to try to make motor vehicle life safer with technology of the motor vehicle, with design of highways, with the way that we limited speed, with the things that we did to try to keep people from driving impaired. All those things have led to tremendous improvement in the number of motor vehicle deaths that we see. As a matter of fact, this is the year that the lines will cross where there will be less motor vehicle crash deaths nationally than there will be firearm deaths. And I think that's very significant. So we have to learn we have to learn to live with guns the way that we've learned to live with the motor vehicle. And I think there are ways to do that. There are a lot of great interventions that we can do.
It brings to mind when the first laws came in requiring the use of seatbelts, how much blowback you had, and maybe this should be looked at in the same way. We need some protections to make sure that we use these things safely.
Right. There's 350 million weapons, we think, that are out there in the community. That's a hard number to exactly quantitate because some of these are unregistered and not really clearly owned in a way you can trace them. But that's just way too many weapons to confiscate, to eliminate. We're never going to walk that back. So what we have to do is make sure that the folks that have them in the home are aware, as Dr. Sagi said, about the danger of having these unsecured weapons when you're around kids, when you're despondent, depressed, when you're in a domestic violence circumstance. It elevates the likelihood that that weapon will be an instrument of homicide or suicide.
So you bring up a very important issue that I know from my personal practice when I ask about it, and you occasionally get the patient says, "Why do you want to know?" And I said, well, I know for a fact that one of my patients is alive today because we knew he had a gun and we were able to secure it. And when he was quite despondent, and I'm sure that he was quite happy that we made that intervention when we did. How big a problem is that? How does that compare in terms of the gun violence?
I believe in the United States there are now more suicide deaths than homicide deaths. And one thing we know is that when someone attempts suicide with pills or something else, they're very likely to live. And if they live through a suicide attempt, they almost never, maybe 10% or less, will eventually die of suicide. So if you make it through that first attempt, you're very likely to live on. But if you use a gun instead of a pill or some other method, you're going to die. And one of the things that my favorite medical journal, The New Yorker, published a series of interviews a few years back with people who jumped off the Golden Gate Bridge. And my favorite quote from that was, the moment, and survived, obviously, they're available for interview. So the moment my feet left the rail was when I knew that all of my problems were going to go away, except for this one. And I think that that's really what happens when people make a suicide attempt. Some little part of them wants to stay alive. They let someone know. Something happens. With a gun, there's no time for a second chance. So we know that if there's a gun in the home, the risk of dying of suicide is higher. If you live in a state with more guns in homes, you have a higher suicide rate. So the data there is very clear, and sort of like your patient, I think we owe it to our patients, if they're moody or despondent, to ask them, do you have a gun? Ask their family members to get rid of it for a while, or put it somewhere else, or do something, because we want people to live and be able to get through it. Depression is treatable, death is not.
And just recently, as you recall, there was a tragic death of a physician who was killed by a despondent relative of a patient who had died. And this relative had blamed the physician for the bad outcome of their loved one, and he went to the office and shot and killed this doc. What you read afterwards was the family of the shooter saying that all through the holiday time this person was very, very depressed, but they never thought he would take the next step. So this was something probably that was being verbalized and nobody acted on. And that's a very important part of, I think, the public health approach, is to empower families to recognize that this mental health issue that you hear a lot of people talk about, you know, it's not the shooter, it's not the gun, it's the mental health problem. Well, if it is the mental health problem, we've got to at least face it and recognize it and say that's not a person that should have a weapon right then.
But that's not a simple solution. You don't necessarily know that beforehand, but the knowledge of the despondency or the acute state of trouble would give families and physicians time to act on that and talk to the perpetrator. I'm sure he'd be better off if he could have controlled that
Sure.
moment. And I'm sure he recognizes that now.
Right.
Yeah. You know, through the National Violent Death Reporting System, they've looked at deaths of teenagers from suicide. And the length of time between when a teenager decides that he or she might want to kill him or herself and the time they try is often measured in minutes or hours. So when there's a gun available at home, that can lead to tragedy. And when there's not, teenagers are a little flighty, and they don't kill themselves. So the stories that you hear from teenagers who killed themselves are just terrible. My girlfriend broke up with me. My mom grounded me. I didn't do well on a test. I mean, all things that as an adult, a person over the ripe old age of 20, you kind of realize that those things they're just part of life, part of growing up. May not be happy moments, but they're not worth killing yourself over.
Oh, we know that the frontal lobes aren't fully developed.
Right.
Your impulse control is a little bit suspect. So what then should the physician be doing in this? You know, I do it just because I think of it as an important thing to ask, and it's also in my new electronic medical record to ask it. But I guess in some states, such as Florida, they try to pass laws that I can't even talk about this, which to me seems absolutely absurd, because I'm not saying I don't want you to have a gun. I'm saying, you know, is it locked? Is the ammunition separate? That's all I'm asking. I'm not.
Right.
How do we deal with it?
I think the you know, as we speak, the 11th Circuit Court of Appeals is considering whether that approach in Florida is constitutional or not. The ruling so far is that the doctor-patient interview is conduct, not speech. And so the docs were trying to defend themselves in Florida, saying that their interaction with the patient is an exercise of their First Amendment rights, and the First Amendment is being trumped by this law because of the protection of Second Amendment rights. I think we got to take the amendments out of it and just say, look, I'm concerned as your physician about your health. We're learning all the time new things about the kind of despondency that will lead to suicide, the kind of domestic violence that can elevate when there's an unsecured weapon in the home. Again, the Harvard School of Public Health just published a study that said that over 60% of teen suicides nationwide are being done with rifles. And this is very important because a lot of people say the handgun is the bad actor in interpersonal violence, and it is, it definitely is. But when it comes to suicide, a lot of the folks that are in the community have these rifles laying around a barn, a garage, a shed. They don't think much of them because they're old squirrel rifles or whatever. But when a child is left alone and has that despondent moment, like Bob mentioned, that's when they'll swallow that barrel. So there's no unsecured weapon that is not a threat to the family that lives in that home. And that's really the message that the physician has to do. Forget about the amendments and just say that that is a danger to you if you don't secure that weapon. And if you don't have a way of securing it, we ought to supply a way of getting rid of those weapons.
You know, when families come to me, they want my advice. That's why they come, and they talk to me about things like toilet training in school, car seats, bicycles, sleep, all of those things. And how can anyone tell me that I can't talk with parents about something that's such a risk for their children? And I do it respectfully because I like my patients. I actually admire what their parents are doing. But one of the things I owe them is the benefit of knowledge from my training. It has nothing to do with the First Amendment or the Second Amendment. We need to talk about the issues that they're facing. And frankly, I talk with some families about some things, other families about other things. It depends on what's going on with them and their child. But you can't take something that is one of the major threats to the life and well-being of a child and say you can't talk about it. My patients wouldn't like it. I wouldn't think that I'm doing my job. And it's just, you know, what if they say, doctor, soda manufacturers have lobbied us and decided that we don't want you talking about sugar-sweetened beverages because it's really hurting sales, and it's every parent's right to choose whatever beverage their child wants to drink. And it's fine, it is their right to choose it, but they can hear from me that if your child's thirsty, they should drink water. And I'm very concerned about this creeping politicization of what we do with our patients and their families. It's not about politics, it's not about the law, it's not about the Constitution. It's about the reason parents come to me and we talk and I examine their children and I work with them is to keep the child alive and healthy and to meet their best potential.
I couldn't agree with you more, and I'm supposed to be neutral in these things, but you're talking about your patient's health, and that should be privileged communication. That's not public communication. I want to talk to you about your depression. You know, that's an important part of it, I would think. So, what other things do you say when you discover that there's an unsecured weapon in the house, or you discover that dad thinks he should sleep with a loaded gun under his pillow?
Yeah.
What are you? How do you approach that?
Well, what I talk with parents about is just the fact that in a young child who's home, the child's curiosity is a force of nature, and that many studies have shown that you can't tell a child not to touch something, that they will touch it. And there's this wonderful series on one of the television networks where they have the kids go through the gun safety class, and then they put them in a space with guns and they all played with them and pointed them at each other. And it's the way kids are. And it's one of the wonderful things about childhood is this curiosity. So you can't teach a child not to touch the gun under the pillow. And I talk to them about what are the statistical realities. Is someone going to break into their home? Which might happen, I suppose, or is the child going to be there, which is, you know, the child's there all the time. So we try to talk about it in a common sense way. I give them the information I have. Ultimately, they make the decisions. I don't, you know, send the police out to steal their gun or something. We talk about it, they get the information from me, and presumably that starts a family conversation. If it's a teenager who has a gun is a danger sign. So we talk with the parents sometimes about the gun, but a lot about their behavior, what else they're doing, where they're going after school, how are they engaged, all of those things, because that for me is a bad thing in itself, but it's also a sign for all those adolescent behaviors that we need to talk about. And so it's one of many risks that the child faces, and it's an important risk in and of itself, but it also means a lot.
What is the relative risk of a teenager of, say, you know, we all worry about cholesterol. Compare that to our risk of injuries from other things. Do you know how they stack up?
Yeah, for injuries of all sorts are the #1 killers of children after birth defects in early age. But for the rest of the age groups, it's injuries, and of the injuries, firearms injuries are now overtaking motor vehicle accidents. So it's a very important risk for children, and it's an immediate risk that if you have other diseases, there's going to be some time, and there's a way to usually to work on it. But with guns, if the risk happens, it's immediate and devastating. I think the other thing I want to talk about is that we've talked about the person who dies, or the person who kills the other person, but we also are facing a huge problem with everyone who's affected. That we all know gun violence occurs in some communities more than others. I had a kindergartner who cried on the way to kindergarten. So I asked his mom, why does he cry? We talked a little bit. And then I noticed he had a little button on his backpack. And in Boston, there's an organization that gives out little buttons when someone dies from violence at the funeral, so people can remember that person. It's a picture of the person and their name. So I asked him who it was. He said, "It's my uncle. Tell me about your uncle." My uncle's the one who taught me how to cross the street and what happened to him. Well, it turns out that uncle was shot and killed on a spot that was between this boy's home and school. So when he cried on the way to kindergarten, it's because every time he went to kindergarten, he was reminded of his uncle. And so that story, magnified by the tens of people who each person who dies was important to, and what happens in communities where people are afraid to go outside, afraid to send their children outside. All of these things really have a devastating effect on children growing up. It's the direct effects, but it's also these community effects. And I think what we're finding now is that communities are organizing. So now there are campaigns for girlfriends, mothers, wives, not to help their boyfriends, husbands, brothers get a gun, not to store it for them if they need it stored, but to really activate the women in the men's lives to get them to be a force around this issue. And these things are starting to work. Gun violence is terrible, but it's on the way down. Gun ownership is still very high, but it's on the way down. So I'm very optimistic that people are really beginning to take much more seriously these issues of guns in the home and gun ownership and our view towards violence. I'm optimistic that this trend will continue.
We touched on something in the introduction about the gun buyback program in Worcester, which is that started out in Pittsburgh with you, is that right?
Yeah, I was a co-founder of a program in '94, and in Allegheny County, where Pittsburgh sits, we've collected about 11,000 weapons in the last 20 years. In Worcester, we started in 2002, and we've collected over 2,500 weapons. And this past year, we had 14 municipalities around Worcester participate as well. This coming year, we're hoping we always do it coincident, unfortunately, with the Newtown tragedy's anniversary. We think we're going to have a statewide program. Basically, we're not getting rid of all of the state's guns, but we're giving people an outlet so that if they do have one of these unsecured weapons, they can come in and get a gift certificate in exchange for it. It encourages a little shopping and makes people think about public safety, and it gets the discussion about guns out in the papers.
But Bob, you touched on that in our earlier conversation. You said there were some statistics that you had about what happens with unsecured guns. Can you refresh my memory
on that? No, just
that?
if there's an unsecured gun at home, the risk of a homeowner or someone who lives in that home dying from homicide or suicide is far greater, 4 or 5 times as high as if there's not a gun in the home. And the only way to protect that is to get the gun out of the home or to keep it locked and the ammunition locked separately. So much of this gun violence is really fundamentally impulsive. So just slowing people down, we're not going to get rid of the 350 million guns, but if we make it so you have to have some effort to get to it, even that will reduce the incidence of gun violence.
So what about on the manufacturer's side or the gun dealer side? Do we have anything going that we've got technologies all over the place that make other would-be dangerous products less dangerous? So
it's crazy. You talked about cars before. It used to be the steering wheel of a car was a solid piece of steel, and if you got in a crash, it would spear you. And people died that way. So the steering wheels don't do that anymore. If you drop a gun, it's likely to go off. If you're a 2-year-old reaching around your mom's purse, you can accidentally fire the gun. All these things, we know how to make them safer. Manufacturers have known for a long time how to personalize a gun so that if you're wearing a ring or something, it will fire. If you're not, it won't. We live in an age where my iPhone knows who I am with my little fingerprint. There is so much technology that's simply not applied. And one of the disgraces in this country is the Consumer Product Safety Commission specifically can't look at guns. So you can have cheap guns that misfire, that backfire, that a child can fire, that you can just sell and there's no liability for the manufacturer. We can do better than that.
Yeah, it's a immunity that no other industry's been granted, so it really should be corrected.
So are there other approaches to gun safety that we should be looking at?
Well, a trigger lock, cable lock costs about $7. And I think physicians should have a stash in their office and be talking, as Bob has said, to their patients about the safety of unsecured weapons, and that there's a responsibility that goes with the gun ownership, and give these out.
That's a seed of an idea.
Yeah.
Maybe we can push that through the Mass Medical Society or something like that.
And I think that there are, in New Hampshire, the gun store clerks are learning how to recognize the signs of depression, so that the clerks are more likely to send you to the Samaritans than sell you a gun. I think that we have a lot of natural allies. Nobody wants to see people die. We just have to get up and say, we've had enough. We're fed up. This country is filled with ingenuity. We're filled with people who really want the best. And it's not just the right to bear arms, it's also the right to life, liberty, and happiness. And we can do that. And I think that once we've changed the social norms, the rest of this is really fairly straightforward. We as a country have dealt with bigger challenges.
Well, Dr. Sagi, Dr. Hirsch, this has been a wonderful discussion. I'm sure we could go on for a couple more hours just discussing all these things. Do you have any parting thoughts for our viewers at home?
I think that Bob said it beautifully, that the witnessing of violence, the experiencing of violence, all of that can be avoided with some simple steps. So we can make a difference, and I think physicians have to be able to advocate for that freely, unfettered.
And every parent should know the safest home for a child is a home without a gun. If there's a gun in the home, the gun should be kept locked and unloaded, and the ammunition locked separately. Just those steps would save so many lives of young kids and adolescents.
Well, thank you both. This has been a marvelous discussion. For more information on guns and public health, visit our website at physicianfocus.org. I'm Dr. Bruce Carlin. Thank you for watching.
I'm Dr. Michael Hirsch.
I'm Dr. Bob Segi.
Deaths and injuries from firearms continue to shine a spotlight on gun violence as a public health issue.
The health risk of guns to young people is especially alarming, as firearm violence has become a leading cause of death and injury for children and teens.
Guns in the home raise special concerns because they significantly raise the risk of homicide, suicide, and unintentional shootings.
More than 1 in 3 homes with children under 18 now have a gun. If your home has a firearm, we urge you to take precautions to protect your child.
Store guns unloaded and locked in a safe with ammunition locked separately, and make sure the homes your child visits are safe as well.
For more information, visit the Massachusetts Medical Society for a copy of Protecting Your Child from Gun Injury.
I'm Dr. Susan Hardy.
I'm Dr. Brenda King.
Alzheimer's disease is the most common form of dementia, a condition that robs patients of memory and impairs their judgment and ability to understand and communicate.
More than 5 million Americans are currently affected, with most of those over 65 years old. But the number of patients with the disease is increasing as our population is aging.
While the effects of Alzheimer's on patients are cruel and tragic, The disease also takes an enormous physical and emotional toll on family and friends who act as caregivers.
A caregiver's burden can take people by surprise and seem overwhelming. The stress and strain can begin early, and it's important to find and use available resources.
So if you are or will be caring for someone with Alzheimer's, act promptly to get help.
To learn more, visit the Caregiver Center of the Alzheimer's Association.